Aplastic anemia is a rare and serious blood disorder. It occurs when the body's bone marrow stops producing enough new blood cells, which are crucial for our survival. This shortage of blood cells can lead to a range of health problems, affecting the body's ability to function properly. These problems can be serious and even life-threatening in some cases, requiring immediate medical attention. Understanding this complex disease involves recognizing its rarity and the challenges it presents. It also means understanding its potential impact on different aspects of a person's health, from physical to emotional well-being. The bone marrow is a spongy tissue found inside our bones, acting as a vital component of our body's blood production system. It acts like a factory, constantly producing stem cells that are essential for creating new blood cells. These stem cells then mature into red blood cells, white blood cells, and platelets, each serving a unique function. Red blood cells carry oxygen throughout the body, ensuring that our organs and tissues receive the oxygen they need. White blood cells fight off infections, acting as our immune system's warriors and protecting us from harmful pathogens. Platelets help our blood to clot, preventing excessive bleeding and aiding in the healing process. In aplastic anemia, this intricate production line within the bone marrow malfunctions, leading to severe health issues. The delicate balance of blood cell production is disrupted, causing a significant impact on the patient's health. This disruption leads to a deficiency of all three types of blood cells, a condition known as pancytopenia, which can be very dangerous. The severity of aplastic anemia can vary greatly, depending on the extent of the bone marrow failure. Some individuals may experience mild symptoms, which can be managed with proper medical care. Others may face life-threatening complications, requiring intensive treatment and constant monitoring. The rarity of aplastic anemia makes it a challenging disease to study and treat, but ongoing research offers hope. However, researchers continue to make strides in understanding its causes and developing effective treatments, bringing new possibilities to light. This essay delves into the intricacies of aplastic anemia, shedding light on this complex condition. It explores its causes, symptoms, diagnostic procedures, and treatment options, providing a comprehensive overview of this rare but serious blood disorder and offering insights into the latest advancements in medical research. The exact cause of aplastic anemia often remains a mystery, leaving patients and doctors searching for answers, making it a diagnosis of exclusion, where other conditions are ruled out first. This means doctors rule out other blood disorders before confirming aplastic anemia, a process that can be both time-consuming and stressful for patients. However, several factors can contribute to bone marrow failure, providing some direction in the search for a cause. These factors provide some clues into the potential triggers of this complex disease, helping to narrow down the possibilities. One potential culprit is the body's own immune system, which can sometimes turn against itself. In some cases, the immune system mistakenly attacks the bone marrow, thinking it is a threat. This attack disrupts the production of new blood cells, leading to a dangerous deficiency. This autoimmune response can be triggered by various factors, including viral infections, exposure to certain chemicals, or even pregnancy, making it difficult to pinpoint a single cause. Another possible cause is exposure to toxins, which can be found in many environments. Certain chemicals, such as benzene, are known to be particularly harmful. Pesticides and arsenic are also dangerous, and exposure to these substances can have serious consequences. These chemicals can damage the bone marrow, impairing its ability to function properly. This damage impairs its ability to generate new blood cells, leading to a range of health issues. Long-term exposure to these toxins, often in industrial settings, poses a significant risk factor for developing aplastic anemia, highlighting the importance of workplace safety. In some instances, aplastic anemia is inherited, passed down through families through genetic mutations, adding another layer of complexity to the diagnosis. These mutations can affect the bone marrow's ability to function correctly, leading to a deficiency of blood cells and requiring genetic testing to identify. Genetic testing can help identify these mutations and assess the risk of aplastic anemia in families with a history of the disease, providing valuable information for future generations. Radiation therapy, often used to treat cancer, can also damage the bone marrow, adding another potential risk factor. High doses of radiation, while targeting cancerous cells, can inadvertently affect the bone marrow's ability to produce new blood cells, necessitating careful management. This side effect is a significant concern during cancer treatment, requiring careful monitoring and management to ensure the patient's overall health is maintained. Recognizing the symptoms of aplastic anemia is crucial for timely diagnosis and treatment. This condition can be life-threatening if not addressed promptly. Fatigue is one of the most common symptoms, as the body struggles to get enough oxygen due to a lack of red blood cells. This can make even simple daily tasks feel overwhelming and exhausting. Frequent infections can occur because of a shortage of white blood cells, which are essential for fighting off pathogens. This makes the body more vulnerable to illnesses and can lead to severe complications. Additionally, easy bruising and prolonged bleeding can happen due to a lack of platelets, which are necessary for blood clotting. Even minor injuries can result in significant blood loss. Other symptoms might include dizziness, shortness of breath, and paleness. These symptoms can severely impact a person's quality of life and overall well-being. It's important to note that these symptoms can vary widely among individuals, making it essential to seek medical advice if any of these signs are present. Early consultation with a healthcare provider is key. Early detection and intervention can significantly improve outcomes for those affected by aplastic anemia. Timely medical care can make a substantial difference in managing this condition effectively.